We're back talking about, we're going to talk about affordable housing now. So a little bit of context, you can supply context as well. Mm-hmm. What we've learned here is that the need over the next 20 years, just on San Juan Island for new affordable housing units is over 400 in the next 20 years. I'm not good at math, but I think that's 20 a year for a long stretch. It does not appear at this moment that we are exactly on track for that. Gosh, that's all I know. That was easy. So tell us more about affordable housing.
So, the Resource Center's role in housing support has traditionally been more about people who are in arrears or in a housing crisis and need temporary assistance. We sort of serve as the agency through which different streams of funding, including some funds from the county and quite a bit of funding that comes through community development block grants, and it goes to Bellingham to an agency called the Opportunity Council and then gets channeled out here to serve our region. So those programs get administered through the Resource Center. So really our primary involvement to date has been with rental assistance and eviction prevention. Yeah, we've seen those numbers go up quite a bit. I think one of the trends that maybe community members are a little less aware of is the demographic where we're seeing the need increase the most is with single people 55 and over who are, they're living alone, they're living on fixed incomes, maybe disability, maybe Social Security, and the cost of rent is just far outpacing what they can afford, and many of them have lived here for a long time. Or they may have been in a private rental situation where homeowners decided to sell because real estate market is sort of prime these days for doing that. So those are the most difficult situations we face, is community members coming in who are on a fixed income, they've lived here a long time, this is their community, and they've just found out that they're going to be out of housing in a month. And where do they go?
So you can help with the money, but can you, if the place
we don't have a magic key to an empty apartment.
If the place is disappearing.
Exactly. Right. And so that's increasingly what our housing support staff are confronted with every week, is people coming in, and here we have money that can help with move-in costs. Move-in costs have just gotten to be tremendously expensive too. If you're talking about, first and last month's rent and an equivalent deposit, when you're talking to someone on a fixed income and it's going to cost $5,000 just to get in somewhere, that's huge for a lot of people. So, the good news is, yes, there are resources, financial resources to help pay with that initial move-in cost, or let's say it's a situation where someone was injured off the job and lost work for 2 weeks or 4 weeks and just needs a little extra help to pay their rent for a month. Those things are doable. But when it comes to finding housing for people, that's a whole different set of problems. And then, of course, we're also working with a lot of people who are more vulnerable, seniors, people with disabilities, where there may be additional needs in terms of an accessible ground floor unit, and the existing affordable apartment complexes can have a wait time of up to a couple years easily.
Oh my gosh.
Are people being ultimately, with these circumstances, are they ultimately being forced off the island?
Some people are being forced off the island. We've had a little luck occasionally of finding temporary shelter through mainland agencies. If someone is willing to go live off island for a while and wait until an apartment opens up that's affordable, So we have been able to help a few people navigate that process. That's a tough one.
That's a tough one, yeah.
You know, it means, you know, in the situations we've helped with, it means finding a temporary home for maybe your pets, being upended and being willing to live somewhere else anywhere 6 to 18 months, which means holding down a job gets really challenging. But some people have opted to do that because this is their home.
Overall, is it getting harder and harder for low-income people to live on San Juan Island?
Yeah, absolutely. Absolutely.
What can be done?
Building that affordable housing. Yeah, and making sure that the income criteria really meet the needs of our lower income community members. Again, many of whom are, you know, in their 50s, 60s, 70s. They've worked hard their whole life, but living on Social Security. I mean, we see a lot of people coming through our door who worked hard for many, many years at low-income jobs. They were frugal, they did everything they could, and now they're living on $1,400 to $1,600 a month of Social Security.
So even if there is housing security, let's say they're living in a paid-up house or something like that, is it harder to live here just with the cost of living?
Sure, sure, because as we know, the cost of living has gone, I mean, it's gone up everywhere, and out here it's just a notch more expensive.
So does this put pressure on Family Resource Center to kind of keep things working and keep lives working and keep people here?
You know,
do you feel more pressure?
Sure, because you care about the people you serve, right? I mean, I think for our team, we have to do a lot of intentional work about doing the very best we can with the resources we have and knowing that that's what we can do. Because otherwise, yeah, burnout gets to be tremendously high. It's hard. It's hard on people who get into this sort of profession who really care, and they care about the people they're working with. They're their neighbors, their community members, and they want to see situations succeed. And so, yeah, if you're working in a job where you're confronted with, you know, seeing people with real hardship situations, and sometimes there's just no good answer, that can become pretty stressful. Yeah.
So would you, in ranking the challenges here, would you rank affordable housing as number one of the challenges in
Yes.
your domain?
Yeah.
Yeah.
Yeah. Because it impacts everybody, right? And under that umbrella of affordable housing comes things like, you know, the number of families who are living in very substandard housing, right? Where it's not safe, it's not healthy, and then so many people living in very tenuous housing situations where maybe they can only get a lease for 6 months at a time. That's another trend now, right? Like, oh, sure, you can rent this place from October till May, and then you have to be out.
Totally unworkable.
You know, so you have a lot of people trying to raise families and get to work each day with that stress hanging over their head of knowing they're going to be losing their housing as soon as summer gets here. You know, there are all these nuances to the challenge that really make it tough.
Do you have a sense of how many affordable housing units are needed right now?
Here on the island, that would be a good question for our county housing person. You know,
So you don't?
I think that, you know, 40 new units sure would help. You know, one thing that happened with housing, and maybe you've talked with people about this before, I don't know, is some of the apartment complexes in town were originally built with federal loans, you know, low-cost federal loans where there was a stipulation that they had to be affordable for 20, 25 years.
Right.
And a lot of those agreements expired right around 2015, 2016. And so we lost affordable housing stock, out of the existing apartment complexes. So that already created more of a shortage than there used to be. And then you see rents rising as well. I mean, there have been some moments of success. The Opportunity Council, which is this big regional human services agency, was able to buy one sort of scoot in and buy one apartment complex and keep it affordable, thank goodness. We still have a few others, but yeah, we need more, especially I think for older single folks and families with children. And we also need the sort of wraparound supports, case management, embedded supports to make people secure and stable in their housing and make it a success. I mean, not everybody needs that, but some people
do.
Some people really do. Yeah. One of the things that we do kind of behind the scenes that I think people aren't very familiar with is we have a program called Island Neighbors that provides mostly volunteer-based help for people who maybe have health challenges or are living at home with a disability, and also just for a lot of older folks who live alone. And sometimes people get to a point where keeping up their house becomes difficult. And then if they're in an affordable complex, there are regulations about the condition you need to keep your apartment in, et cetera. So we have a number of volunteers and a staff person who will go in and help with, developing hoarding situations or just find solutions for people who are really low income and elderly and need that extra support to keep their home healthy and safe.
So Island Neighbors is a staff member and volunteers?
Yeah. How
do you know to go into a situation? Are you invited into a situation?
Typically, yes.
Sometimes referred?
Sometimes referred. We've partnered quite a bit with the community paramedicine program in the past. So sometimes it's a joint effort between community paramedicine and the resource center. It is not unusual for us to get calls from adult children who live far away and are concerned about a parent who's living on the island and still wanting to live independently, but just having a harder time with it. It is a harder place to age in place here.
Is that a scalable program? If you got more calls like that, would you be able to respond? Are you maxed out on that?
We're pretty maxed out at this point, and things are in flux because our public hospital district is also, shoring up some efforts to provide more in-home care and support. So it's kind of an exciting time because I think the hospital district is going to be providing some of that. It won't be volunteer-based necessarily, but we're at a point where we're sorting out, projecting out ahead the next 5 years, what will the hospital district be able to provide through its home care program? Maybe that's for a fee. What are the needs that we would need to address? Because our program is volunteer-based, we have to be really careful too with the parameters of what we have volunteers do and not do. We don't do medication management with volunteers, obviously. No money management. That's a hard one. A volunteer may go in and see piles of unopened mail. Who's going to help with that? So sorting out those details. I would say and that comes back around to the affordable housing piece, which is that case management support, having some dedicated professional hours for more people who can do that, either doing outreach into people's homes or through our center, I think is a critical part of the success of affordable housing if we're really going to make affordable housing work for the broadest spectrum of community members possible who need it.
Well, we do have the oldest population of counties in the state, getting older all the time.
Yeah.
So these services are really important to kind of stay ahead of them. And I'm glad to hear that you and the hospital district are addressing that need.
On the other end of the spectrum, I know you guys have been doing a lot of work with like perinatal and young families. What are those programs and what is that like?
Yeah, well, we've always had these roots in early childhood and support for families with little ones under the age of 5. So we continue. Our drop-in play groups are the oldest program we have at the Resource Center. They've been going for about 25 years. We do one program in partnership with the library, which is really lovely. That's more literacy based, but also has playtime and circle time. We have a group called Rain or Shine Play Group, which meets year-round outdoors. So it's all about helping parents learn about how to get their kids outside, regardless of what the weather is. But in the past few years, we've definitely put a lot of effort into expanding those supports for young families. Childcare being the biggest issue. We had skirted around being a direct provider of childcare for a long time, and that was another thing that really became so exacerbated by the pandemic is the lack of childcare. While the pandemic was happening, we were fortunate to get a grant from the State Department of Commerce to do a community-wide needs assessment. So we collected a lot of information from parents and families, from child care providers, from local businesses, really extensive surveys of how child care or the lack thereof was impacting these different segments of our community. In the couple of years leading up to the pandemic, so it wasn't just pandemic fueled, but in the couple of years leading up to that and then through 2021, we lost 40% of our professional childcare on the island. And a lot of that was just because the model for providing childcare for kids under 5, it just financially it's almost impossible to make it work. You have these state mandated ratios of adults to children. And you have, what families can afford to pay in tuition, and, child care center directors and preschool directors who are passionate about what they do, and it's a financial model that's just really, really tough to make work and to pay someone a livable wage to do that work. The biggest gap there was for infants and toddlers. There was no professional infant care. 0. And when we did the survey, we had close to 60 families that needed care for a toddler in order to be able to go to work. These were working families, and there were 7 spots for toddlers on the whole island at one child care center. So we've done a lot of work around that. We actually did end up partnering with Skagit Valley College and opening an infant toddler child care cooperative with an absolutely incredible group of local parents who really stepped up. And I'm still in awe of these parents who basically brought children into the world in the middle of a pandemic, were working full time, coping with being new parents, and stepped up to help create this co-op, which was an enormous lift in terms of finding a teacher, finding a space, developing all the policies, doing the outreach.
How many of those 60 families in need are being served now?
I couldn't tell you of those original 60. The co-op we started up has 15 spaces for infants and toddlers, so it certainly didn't solve the whole need. Be interesting to have a show all about childcare because it's an issue that really impacts so many of our working families out here across a wide range of demographics. We do have a new infant toddler care provider who's going to be opening soon. If maybe she's opened already. It's in the works right now, so that's exciting.
Is that over by the airport?
Yeah.
Oh, nice.
And we do have an ongoing child care capacity building work group that we formed up when we had that first grant from Commerce, and then we actually received a continuation grant this last year to do a little more work around sort of a feasibility study and looking at public-private partnership models and what it's going to take. I still feel like for a community our size, with the degree of education so many of our community members have, and the economics out here, San Juan County should be able to figure out the absolute best childcare of anywhere.
The schools are good.
The
So
schools are good.
Why don't we solve that?
So we've got to figure
The younger
out
group,
this 0 to 5 group,
Yeah.
and pay those providers. I mean, I don't know if either of you have ever taken care of a toddler all day, but
It's a lot of work.
it's exhausting.
Yeah.
Right? And you are on your feet and there is no downtime, and paying those teachers a living wage and providing them with benefits, health insurance, some paid time off.
I think we need a childcare summit,
Yeah,
televised
That'd be
childcare
cool.
summit. You'll have to come
that
back,
sounds pretty fantastic.
but I
There's-
think we should do that.
Yeah,
Because
there's-
it does sound like something that could be solved, doesn't it?
I think it's something that can be solved, and our friends over on Orcas Island, who started the Early Childhood Education Initiative, have been doing some absolutely phenomenal work
Yeah.
in creating a private funding source that really is responsive to the needs of each center, and really listening to what each preschool and each childcare center has to say about what their needs are. So it's not a cookie cutter model of we're just going to give everyone the same thing, which creates choice for parents, right?
Well, I hear another television show coming. So thank
Absolutely.
you for that. Always looking for new ideas. We're going to take our last break here, and then we're going to be back in a couple minutes.